It is not my expectation that we will require mandatory masking in indoor spaces. We know that it is an additional layer on top of the other layers that we use to keep each other safe, and it is the least effective of the many layers that we have. We also know that there are reasons why some people cannot effectively wear masks, and we need to be able to accommodate them without stigmatizing people. Having said that, we also look at the data around the world and where these are most effective. And we do not have a lot of community spread. We know exactly, we know fairly well the types of situations where we are seeing spread of this virus in our communities. So right now, I do not believe that there's sufficient community spread that we are at that point where mandatory masking, which is a rather heavy-handed approach, is needed. We do absolutely and will continue to encourage and recommend strongly that people in areas where you cannot maintain that safe physical distance for a period of time, so we're talking particularly transit, but smaller stores where barriers may not be in place, things like that, that you absolutely should wear a mask, and it's to protect you and to protect your neighbor when we're all doing it. And we do it as a matter of courtesy and respect for our community. And I have seen many more people wearing masks, and that's very gratifying. I do it myself. If and when we get to a point where we have a lot of community transmission, where we're seeing a lot of these transmission events happening in places like transit or in places like retail stores, then this is an option that we can move to. But it is not something that I'm considering at this point.
I think what BC has really been recognized for in our response to COVID-19 is following the advice of public health experts, and of which Dr. Henry is the provincial health officer, but we have outstanding experts around the province, and we follow the advice with rigor. In the case of masks, for example, like Dr. Henry, when I go to grocery stores and when I go on transit, I wear a mask, and I would encourage people to do so in those circumstances. It's the view of public health, based on the evidence, that a mandate is not desirable at this time, and that's the decision that should be properly in the hands of public health. But it does remind us of one other thing, that Dr. Henry talks about a hierarchy of ways we can stop transmission. At the top of that hierarchy is physical distancing. And wearing a mask does not take away the obligation to physical distance. It does not take away the obligation to make the next level of the hierarchy, which is to take measures to stop transmission, things like plexiglass shields at grocery stores that we've seen everywhere, or other rules that limit gatherings of people and the numbers of people gathering together. And wearing masks is of value, but it is on the hierarchy that has been described repeatedly by public health at the bottom of that list. And I think some people may believe that by wearing a mask we can avoid all these other things, and in fact that is not the case. The other things are absolutely essential. With respect to any court case, obviously I'm not going to comment on that. Obviously, I think that decisions, public health decisions about what the best course should be supported by the government, but presented and based on evidence, and that's what we're doing in BC, and that's what we've done from the very beginning.